Medical professionals have a unique ability to identify hidden health issues simply by observing the daily hygiene habits of older adults. These seemingly minor oversights can serve as quiet signals of serious underlying conditions. Surprisingly, many seniors are unaware that they're making these critical mistakes daily. In the next few minutes, we will reveal 7 common personal hygiene errors that immediately catch doctors' attention during examinations of elderly patients. Correcting these seemingly insignificant habits can literally save lives, both your own and those of your loved ones. The information presented is rarely found in school curricula, infrequently discussed during doctor's appointments, and almost never mentioned in popular health magazines. Yet this knowledge can be the crucial difference between an active, healthy life in old age and suffering from preventable diseases that rob individuals of their independence and dignity. Stay with us to learn which. Hygiene mistakes can be dangerous warning signs and how to take timely action to maintain health and well-being. Let me introduce you to Harold, a 75-year-old retired engineer who was confident in his impeccable personal hygiene. Harold was actively involved in his local community, played golf twice a week, and enthusiastically attended his grandchildren's baseball games. However, during what he thought was a routine medical checkup, his physician immediately identified 3 significant errors in his hygiene practices, indicating that Harold had been developing a serious condition for several months without even realizing it. "I was completely oblivious," Harold later shared. "I thought I was taking good care of myself. If my doctor hadn't noticed these seemingly minor hygiene problems, I might not be here to tell the story." Today, we'll uncover the essence of these mistakes so everyone can avoid a similar frightening experience to Harold's. But more importantly, we'll offer concrete solutions, simple changes that can add years to your life, starting today. Mistake number 1, neglecting oral hygiene. When was the last time someone carefully examined their toothbrush? How worn is it? Are teeth thoroughly cleaned twice a day? And here's a more important question. Are you aware that inadequate dental care isn't just about bad breath or the risk of tooth loss? It's directly linked to the development of heart disease, stroke, and even dementia. Geriatric experts from Harvard Medical School have convincingly demonstrated that bacteria arising from untreated gum disease can enter the bloodstream and cause life-threatening heart conditions. In fact, their research shows that older adults who neglect oral hygiene are 3 times more likely to develop cardiovascular disease compared to those who maintain proper dental care. Instead of relying on blind faith, let's look at a real example. Consider Sylvia, a 68-year-old retired teacher from Oregon. For several months, she had ignored bleeding gums, mistakenly believing it was an inevitable part of aging. "I thought it was just part of getting older," she shared. However, during a routine medical exam, a cardiologist discovered a dangerous inflammation of her heart valves. The cause was bacteria from her mouth that had entered her bloodstream. The doctor warned that delaying treatment for a few more months could have had irreversible consequences. So, what steps should you take immediately? First, carefully inspect your toothbrush. If it's been more than 3 months since you started using it, or if you see signs of wear, replace it immediately. Ideally, consider switching to an electric toothbrush. Studies at the University of Pennsylvania School of Dental Medicine have shown that electric toothbrushes remove 62% more plaque than manual brushes. Brush your teeth twice a day, spending at least 2 minutes each time. Use a timer if necessary. Flossing every night should be an essential part of your daily hygiene routine. And, of course, don't neglect regular dental visits, even if you have dentures. If you experience bleeding or swollen gums while brushing, it's not a normal sign of aging. These are warning signs from your body, and you should never ignore them. The second common mistake in self-care is inconsistent cleansing and maintenance of skin health. Ask yourself honestly, how often do you indulge in water procedures? With age, many people tend to reduce the frequency of washing. However, it should be remembered that the skin is the largest organ in the human body, and any metamorphoses in its condition can signal serious internal ailments even before other signs appear. Expert dermatologists from the famous Mayo Clinic warn that in older people, infrequent washing can mask the initial stages of diabetes, liver pathologies, and cardiovascular diseases. Their scientific research indicates that almost 40% of undiagnosed diseases in elderly patients could be detected at earlier stages through careful observation of the skin condition. Let's recall the story of Clarence, a 77-year-old retired postman from Michigan. Clarence believed that one wash a week was quite enough, especially in winter when his skin became dry. "I didn't want to dry out my skin," he explained. But one day, a doctor noticed an atypical change in his skin tone during an examination for another issue. Further examination revealed an early stage of kidney disease. The cause of the color change was not so much poor hygiene, but infrequent washing, which hid an important symptom that could have been noticed much earlier. To maintain healthy skin and nails, certain rules must be followed. It is recommended to take a shower regularly, at least 3 times a week, even if there is no intense physical activity. At the same time, you should use mild, fragrance-free soap to avoid disturbing the natural balance of the skin. After water procedures, it is important to apply a moisturizing cream to slightly damp skin, as this will help keep it hydrated and elastic. Special attention should be paid to regular skin examination. You should pay attention to any changes in color, texture, or sensation. Dry, flaky areas, unusual pigmentation, or constant itching can be signs of serious health problems. You should not postpone a visit to the doctor if you find such symptoms. Care for nails is equally important. Their condition can tell a lot about a person's health. Neat, clean nails without color changes are a sign of good health. Doctors often pay attention to the condition of nails when examining patients, especially the elderly. The American Academy of Dermatology reports that nail changes can be an indicator of more than 20 different systemic diseases, including anemia, thyroid problems, and cardiovascular diseases. Studies show that in patients over 65 years of age, nail abnormalities led to the detection of previously undiagnosed internal diseases in almost 30% of cases. Let me introduce you to the story of Beatrice, a woman whose experience serves as a warning to all of us. At 82, Beatrice did not attach much importance to the changes happening to her toenails. They became thicker and acquired an unhealthy yellowish tint. She decided that these were just inevitable signs of aging and simply stopped wearing open shoes, preferring to hide her feet from prying eyes. "I thought it was normal for my age," she shared. However, when the pain in her legs became unbearable, Beatrice finally turned to an orthopedist. The doctor, examining her legs, immediately made a diagnosis: a fungal infection. The disease had progressed so much that the cause became obvious: the patient's severely weakened immunity. Further examination revealed a serious illness requiring immediate treatment. What steps should be taken today to avoid a similar fate? Trim your nails regularly, giving them a straight shape and slightly rounding the edges to prevent ingrowth. Maintain nail hygiene, keeping them clean and dry. Wear comfortable, breathable shoes and change your socks daily. Most importantly, never ignore changes in the color, texture, or thickness of nails. These are not just cosmetic defects, but potential alarm signals that your body is sending. Have your nails become brittle, changed color, or become unnaturally thick? Do not attribute these changes to the inevitable aging process. Perhaps your body is trying to tell you something important. Will you listen to these signals before it's too late? The fourth common mistake associated with the delicate problem of incontinence is improper care, which is most surprising due to the widespread prevalence and the desire of people to hide this fact. More than half of the elderly face various forms of incontinence, preferring to remain silent. Surprisingly, many try to hide the problem instead of seeking qualified medical help. Urologists from the prestigious Johns Hopkins Medical Institute warn that ignoring incontinence can lead to serious skin infections, an increased risk of falls, and social isolation. It can also complicate the diagnosis of dangerous conditions such as bladder or prostate cancer. Studies show that older adults who address incontinence issues promptly and correctly experience a 60% reduction in complications compared to those who try to hide their condition. As an example, consider the story of Douglas, a 73-year-old retired accountant from Arizona. Embarrassed, he hesitated to tell his doctor about his occasional urine leakage. He tried to manage the situation on his own, using paper towels and changing clothes frequently. However, when painful sores developed, he finally sought medical help. Doctors diagnosed an advanced prostate condition that could have been successfully treated at an earlier stage with much better outcomes. "My pride almost cost me my life," Douglas confessed, regretting that he didn't seek medical attention at the first sign of the problem instead of trying to conceal it. When facing incontinence, it's crucial to discuss the issue openly with a doctor, as it's a common occurrence in medical practice. Specialized absorbent products designed for such situations should be used instead of improvised solutions. It's important to change these products promptly and maintain thorough hygiene to avoid skin irritation. Realize that incontinence isn't an inevitable part of aging, but rather a sign that requires medical attention. If you experience occasional leakage, if planning activities depends on the availability of restrooms, or if you're using temporary protection, don't delay a visit to the doctor. Your health and even your life may depend on seeking timely medical assistance. Errors in ear hygiene also pose a serious problem. Do you often use cotton swabs, inserting them deep into the ear canal? If so, you're making a common and dangerous mistake. Improper ear cleaning can lead to hearing damage and missed signs of serious infection. Otolaryngologists emphasize that incorrect ear hygiene can mask symptoms of potentially dangerous infections. Studies show that improper ear cleaning is the cause of approximately 40% of ear canal injuries in patients over 65, often leading to preventable infections. Consider the story of Patricia, a 71-year-old retired librarian from Washington. For years, Patricia had used cotton swabs to clean her ear canals, striving for impeccable cleanliness. However, this practice had tragic consequences. She punctured her eardrum, causing a serious infection that affected the surrounding tissues. "I've always cleaned my ears this way," Patricia admitted. "No one ever said it could be dangerous." As a result of the incident, Patricia required emergency medical attention and, unfortunately, suffered permanent hearing damage that could have been avoided. So, how should you properly care for your ear hygiene? Remember a simple but important rule. Avoid inserting anything smaller than your elbow into your ear canal. For cleaning, use only the outer part of the ear, wiping it with a warm, damp cloth. In case of excessive earwax buildup, it's recommended to use special eardrops designed to soften it, strictly following the instructions on the package. Seek immediate medical attention if you experience pain, discharge from the ear, or notice changes in your hearing. If you experience itching, a feeling of fullness or stuffiness in your ears, or if you notice unexplained changes in your hearing, do not try to solve these problems on your own. Such symptoms require professional medical evaluation and treatment. Remember, your hearing is a priceless gift, and it must be protected by ensuring proper care. Insufficient attention to foot hygiene can become a serious problem. When was the last time you paid close attention to your feet, carefully examining every area of the skin, including the spaces between your toes, heels, and soles? The feet are a kind of indicator of the state of the circulatory and nervous systems, and that's why doctors pay close attention to them when examining elderly patients. Podiatrists specializing in geriatrics and affiliated with the American Podiatric Medical Association emphasize that foot hygiene problems often signal the early stages of conditions such as diabetes, neuropathy, and vascular disorders. Studies show that in patients over 65, proper foot care and regular checkups can prevent up to 85% of diabetes-related amputations. And it's not a mistake. Proper foot care can indeed prevent such a high percentage of amputations. A case in point is the story of 76-year-old Raymond, a former factory worker from Illinois. He had long ignored dry skin and minor cuts on his feet, attributing them to normal aging. "My feet had looked rough for years," he confessed. However, during a routine checkup, his doctor noticed the condition of his feet and immediately ordered diabetes tests, which revealed the disease in its early stages when lifestyle changes could still make a significant difference. "If my doctor hadn't examined my feet, I might not have known about my diabetes for years," Raymond shared. By then, the consequences could have been dire. From that day on, increased attention should be paid to foot hygiene. Daily washing and thorough drying, especially between the toes, will help prevent the development of fungal infections. Regular inspections will allow for the timely detection of cuts, ulcers, and any changes in skin color or temperature. It is important to wear clean, dry socks made of natural materials or fabrics that effectively wick away moisture. Moisturizing creams should be used for dry skin areas, avoiding application between the toes. Pain, numbness, or non-healing wounds should not be ignored. If such symptoms appear, you should immediately consult a doctor. Dryness and cracks on the feet, non-healing cuts, unusual changes in skin color, or loss of sensation can be signs of serious illnesses requiring immediate intervention. Taking several medications can cause changes in body odor, perspiration patterns, or dry mouth. These changes may be signs of dangerous side effects. Pharmacologists at the American Geriatric Society have found that some commonly prescribed medications cause dry mouth, excessive sweating, or changes in body odor, indicating potential toxicity. Studies show that nearly 40% of adverse drug reactions in older adults first manifest as changes in personal hygiene needs before more serious symptoms arise. Consider the case of Barbara, a 67-year-old retired nurse living in sunny Florida. The strange and unpleasant odor emanating from Barbara's body was initially attributed by her loved ones to poor hygiene. However, an experienced geriatrician was able to recognize this as a worrying symptom of drug intoxication, slowly but surely destroying the patient's liver. "I carefully monitored my hygiene, showered regularly, and used deodorant," Barbara recalls in bewilderment. "I had no idea that the source of the smell was inside my body, not from failing to keep clean." So how can you protect yourself in such situations? First of all, it is necessary to carefully monitor any changes in hygiene habits that occur after starting new medications. It is recommended to keep a simple diary in which you should record the slightest deviations, such as changes in body odor, increased sweating, a feeling of dry mouth, or changes in skin condition. Do not forget to maintain a sufficient level of hydration in the body unless otherwise instructed by your doctor. If unusual sweating or odor changes occur, you should immediately consult a doctor, as this may indicate a dangerous interaction of medications. Under no circumstances should you independently adjust the dosage of prescribed medications without consulting a specialist, even if it seems that they are the cause of hygiene problems. If you notice an unexplained body odor despite regular washing, excessive sweating, or severe dry mouth, you should not attribute these changes to normal signs of aging. These may be warning signs of potentially life-threatening drug side effects requiring immediate medical attention. Geriatric doctors highlight 7 common hygiene care mistakes that are often found in older adults. Detecting and correcting these omissions can play a crucial role in maintaining health and well-being in old age. Timely elimination of these problems can prevent the development of serious diseases, preserve self-esteem and independence, and possibly increase life expectancy. It is important to understand that hygiene is not only a matter of external attractiveness or compliance with social norms, but also a key element of maintaining health in old age. Making simple adjustments to hygiene habits can have a significant impact on overall health and even save lives.